this is a wonderful example of a Republican trying to explain his policy position and fundamentally undermining his policy position. And that's why I love this so very much. This is U.S. Representative Bill Huizenga, who has outlined, a Republican congressman who's outlined the way he'd like to see the healthcare system operate if Obamacare is repealed. Presumably, this will also be the argument for Medicare and other things. But here it is. He is one of these guys who believes that we are not patients when we see a doctor. We are consumers. Like as if you were to go into the stereo store or go into the computer store.
Hey, you're going to have to do better than that. You want to treat my heart disease, okay?
There we go. Here he is, and he's talking to who is it? To like
M-Live.
M-Live. It's like a Michigan like a news outlet. All right, here it is.
Definitely going to be changes in the healthcare delivery system. We can't just continue to squeeze providers to say, okay, well, this is how we're going to save money.
Pause it for 1 second. All right. When he says we can't squeeze providers, what he's saying is we can't reduce the rates of reimbursement to doctors and hospitals and people who own MRIs and whatnot. And that's what things like Medicare and the Affordable Care Act were set up to do. They were able to look across the spectrum of treatment for specific diagnoses and say, hey, you know what? We can see the efficacy of treatment Y versus treatment X. And we're not going to reimburse you for treatment X because it's too expensive and it doesn't have any better outcomes than treatment Y. Some instances, treatment Y may be even better. But just because you own an MRI machine and you get a certain markup every time you use it doesn't mean that's great medicine. So this is what he's talking about, squeezing providers.
It's forcing healthcare providers, whether they're doctors, hospitals, nurses, you name it, into some very different actions that, in most people's opinion, is unhealthy. And
Pause it.
at some point,
That's untrue. There's not most people's opinion it's unhealthy. I mean, actually, most people don't have an opinion on that because they can't. They're not doctors. But the boards that are set up to determine this have determined it. Look at Atul Gawande's story. I think it was in the New Yorker, maybe 5 or 6 years ago, again, about, I think it was McLean, Texas, in 2 towns in Texas, to get more on that. But continue.
And, at some point or another, Chandra, we have to be responsible or have a part of the responsibility of what's going on. Way too often, people are just, pull out their insurance card and it's like, I don't know the difference between and cost between an X-ray, an MRI, or a CT scan, right? I might make a little different decision if I did know what some of those costs were and those costs came back to me.
Pause it.
That's why.
Listen to what he's saying here. It's as if we go in as customers and we're like, I want the very best. Well, actually, all you need is an X-ray. I don't care, man. I want an MRI.
Nope, sorry, I'm treating myself.
No, listen. When the ladies come over, I want to be able to tell them I just had an MRI, not an X-ray, to go with my huge subwoofer that I got. It's like the classic stereo thing. But the guy saying, like, maybe if we knew how much these things cost and we didn't have the money for them, we had to pay ourselves, we would say, no, I'm going to decline that medical care because I can't afford it. Now, theoretically, right, this would also hurt the provider.
Maybe a little bit.
But what it would really do is it just would weed out the pores. And it would really hurt us because we don't really know. We rely on the doctor. Now, the doctor has some misaligned incentives that are much larger than us as patients. Us as patients, our primary incentive is to get healthy. And we trust our doctor to tell us the best way to do that. But if a doctor, and we see this all the time, right? Surgeons always say, you got to do surgery. Non-surgeons say, you don't need surgery. They have an incentive, and they've been educated, and they've grown up to perceive what they've studied and what they own. I own an MRI. That's the best tool to use in all these instances.
That's what the babes like.
Exactly. It can't hurt you. So you see this, the doctors have a misaligned incentive at times. But us as consumers in this case, I prefer patients, but it's consumers really for him. We don't always know what's best for us, but let him tell us a story of how this should work.
Came back to me. That's why I think HSAs, health savings accounts, having pools of money that we put in as individuals and as families really can help us try to keep some of those costs down, because it forces you into making a decision of, it's like, okay, I just had it. My youngest son went racing out the front door on his way to go to jump on the trampoline. I thought he was going to get injured going to the trampoline. He got injured on the driveway to the trampoline, fell, broke his arm, and we weren't sure what was going on. It was in the evening, and so I splinted it up and we wrapped it up, and the decision was, okay, do we go to the ER? We thought it was a sprain, but weren't sure. Took every precaution, and decided to go in the next morning. I mean, the cost difference. Certainly, if he had been more seriously injured, we would have taken him in.
So this guy, in his professional opinion as a congressman, was like, this isn't something that we need to go in for immediately. It ultimately proved out to be a broken bone. God knows how much pain the kid was in, but
oh, that little prick's always running around.
If it was serious, we would go in. But the good thing is we made a decision. Now, he's claiming it's about money. I think it was just about, honey, I'm 2 sheets to the wind right now. I'm not taking anybody.
It's the evening, okay?
Yeah, exactly.
America's got a little too soft.
But giving him the benefit of the doubt that he did this to save money. I mean,
don't they basically have their own version of single-payer health care?
To save, yes. I mean, of course it's BS. But just let's use his example. You make the determination, is my child sick enough now that I can save some cash by not going to the emergency room versus going? Billy fell and he smacked his head. What is it again with the pupils? Are they supposed to be really big or really small? I can't remember. Let's save some money. He probably doesn't have a concussion. We'll find out in the morning if he wakes up. I mean, this is so sick. And the guy doesn't realize that he's just laid out exactly what's wrong with this philosophy. That we as consumers, if we have a pool of tax-free money, let's be honest, there's people who can't even save week to week, never mind over the course of a year because they don't make enough money. But if we have a pool of tax-free money, we can decide whether it's worth it for us to actually spend that money by making a medical determination of how ill a child is. I mean, this is sick and grotesque, and the guy doesn't even realize it. Now, of course, because he's not really making that determination. As a congressman, his health insurance would have covered that visit, no problem. And because he doesn't have to really make that determination, it's very easy for him to make that determination for other people. That we're going to empower people to make a medical diagnosis of their children. And if they pick right, they save some money. If they pick wrong, well, long term, it will probably save them money because
kids are a sunk cost.
Yeah, exactly. So there it is. Thank you, Representative Bill Huizenga.
I also think the maybe Department of Social Services should look into that, dude.
No kidding.
That was kind of amazing.
We put a splint.
Bandaged that little prick up. I thought it was gonna mess himself up on the trampoline. It happened in the driveway. A little prick couldn't even get to the trampoline. What a little pussy. Anyways, if you have a kid like me, who's basically, I mean, there might be some other things going on, if you know what I'm saying. If you have a kid like me, I would say just say, all right, listen, you little fuck. Sleep it off. Dad's going to have another drink. Tell mom that he doesn't love her. Fall asleep in the friggin' easy chair. And if it still hurts tomorrow, we'll take you to the hospital.
We'll have the nanny take you to the hospital.
All right, whatever. So you know what I mean? It's a lot of money that could be saved.
Let me go. Hey, it's Sam Seder. Why don't you subscribe to this channel? You can do so right over here. Over. Subscribe.